the main catalyst to innovation should be a desire to improve and do one's work better. But I guess in the context of healthcare, we've also got a group of people who are actually more conservative. We have been trained in a way to follow protocols quite strictly. And therefore, one element that is sometimes that we wish we can see more in healthcare is this angst, this energy to overcome frustration. I think over the years, we've seen many healthcare workers develop a certain tolerance to certain problems they face at their work. They are very stoic by nature, and so they just go through it. But we do wish that there's a bit more angst and a desire to say that I don't have to do it this way, it can be done better. And that is when people start to think of ways within the framework of safety to find a better way to do things. And I think that element of not tolerating some of these inconveniences, that if we give it a little bit thought, we can actually do things better, is a key catalyst that we hope to see injected into our healthcare professionals in Tock Seng Hospital. As I mentioned, I think healthcare workers tend to be a group of very disciplined professionals trained to follow protocols strictly, and I think that is a good point. However, when there is evidence that you could do something differently in a way that can deliver care faster, better, cheaper, and safer to patients, they should adopt. But why is it so difficult? I think we're all creatures of habit, and we feel this discomfort when we try to do things differently. The other element is because we've spent a lot of time training to do the current method well. And there is a certain attachment and a certain sense that, what a waste if I were to do things differently after all those years of training, I have to relearn. So I think that it needs to be a sort of a culture. They need to see that validated, and therefore we need to create this sort of environment that they feel safe to try new things, to do things where they could see the results, and yet they do not have this constant fear that it's going to jeopardize the safety of patients and affect their professionalism. So therefore, I think it's both a top-down and a bottom-up sort of approach, where at the ground, the staff need to develop that culture to want to do things better, and from the top down, there needs to be this reassurance that this is a proven method of doing things better. Therefore, let's adopt it and let's change our practice. And ultimately, I think it can work because we're all, and I think the focus needs to be on the patient, that the validation that this new innovative method is good for the patient. And I think once that feedback comes back, the positive feedback comes back, I think then there will be a groundswell of adoption. But it often has that difficult initial hump. Most healthcare professionals are not early adopters by nature, and therefore we need that nudge and that demonstration to be able to bring them into that safety zone. And that's why I think in healthcare there are a lot of pilots and a lot of sandboxes to assure people that this is a no-fault environment, and therefore your patient safety has been considered, and that itself can overcome these challenges in adoption.